This lecture has been prepared as an integral part of the project developing a higher education curriculum in SET teaching for the health protection and promotion of intellectually disabled individuals. Today, I will talk about the safety measures for combating COVID-19. Preventive measures play a critical role in reducing the transmission and impact of COVID-19 on this vulnerable population. The Centers for Disease Control and Prevention recommends several strategies to protect individuals with disabilities, including wearing masks, frequent hand hygiene, physical distancing, and avoiding large gatherings. It is important to note that the implementation of these measures should be done in a manner that accounts for the unique needs of children with disabilities. To develop appropriate and effective teaching strategies for COVID-19 education, healthcare professionals who specialize in working with children with ID may be useful. Simplified language and visual aids may also be beneficial to teaching children with ID. It can also be helpful to use technologies such as educational apps and videos. Teaching strategies should be engaging and effective. Additionally, children with ID may respond better to virtual learning if the content is broken down into small, manageable tasks. It is also important to provide frequent breaks, positive reinforcement, and personalized instruction to keep children engaged. Parents and caregivers can also reinforce classroom concepts by providing real-world examples and engaging in conversations with their children. It is critical to remember that they may need more time to process information and require more repetition of concepts. Patience and understanding are vital components of teaching children with ID. Children with special needs may face challenges in understanding and adhering to preventive measures for COVID-19. It is important to use communication strategies that are accessible, visual, and tailored to their cognitive and sensory abilities. Learning outcomes are develop the ability to implement and practice effective safety measures, apply hygiene practices including hand washing and sanitization, as well as wearing masks, practicing social distancing, and understanding the importance of vaccination. Learn how to communicate and educate others about the importance of safety measures, addressing common misconceptions and promoting responsible behavior, and learn the advantages of safety measures in reducing the likelihood of infection, protecting vulnerable populations, and contributing to the overall control of the pandemic. Consideration and strategies for children with special needs in preventing COVID-19. Support for communication strategies. Use visual support, in example whiteboards, to demonstrate social distancing, masks usage, coughing etiquette, and basic coronavirus information. Break down information into smaller units and use symbols to represent key concepts. Provide written summaries or pamphlets with keywords and visuals to support verbal information. Utilize stories and visual schedules as primary tools for sharing new information. Use visual aids, in example picture vocabulary, to facilitate communication during healthcare encounters with youth. Incorporate strategies like talking mats, role play, and games to increase engagements during healthcare education. Dissemination strategies. Disseminate information through various channels, in example social media, websites, to reach youth with credible and reliable information. Cover a range of COVID-19 related and general health topics, including disease prevention, understanding the disease, coping with mental health, disease management, healthy living, and understanding the health system. Address the unique needs of youth with communication and cognitive needs by providing simplified and accessible information to empower them in healthcare encounters. Other health information should be authentic, reliable, culturally relevant, clear, and phrased in accessible language. Visual formats such as graphics, pictures, and videos are effective in making health information engaging and memorable. Auditory formats such as screen readers and audio files can also be used to make information accessible. Resources should be available in multiple modalities, including electronic formats and hard copy formats for those without access to data and devices. Resources should be available in all official languages of the region, including sign language. COVID-19 safety measures and other prevention tips. Hand hygiene. Considering the COVID-19 pandemic, hand disinfection is critical, but it can be challenging for children with developmental disabilities or behavioral problems who tend to touch surfaces frequently. It is important to teach them to properly disinfect their hands and follow state recommendations for washing hands with soap and water for at least 20 to 30 seconds. Children with disabilities have weaker immune system, which makes them more susceptible to infections. Therefore, extra care is needed to keep their bodies clean, especially in hot weather when sweat can accumulate dirt on the scalp. This video demonstrates the proper technique of hand washing for kids, emphasizing the importance of washing hands for at least 20 seconds to eliminate germs effectively. The guidelines and technique recommended by the World Health Organization are followed in this video. After watching this video, students will learn 11 steps on how to wash their hands correctly. They will understand the significance of each step and the duration required to achieve optimal hand hygiene. Students will be prepared to engage actively in interactive activities that delve into the significance of hand washing in preventing the transmission of diseases.
How to wash your hands using the World Health Organization's method.
Hi friends, this is how to wash your hands.
Step 1. Wet your hands. Remember friends, we want to wash our hands for at least 20 seconds to make sure we get rid of all of the germs. Step 2. Use enough soap to cover both hands entirely. Step 3. Rub your hands palm to palm. Step 4. Put one palm on top of your other hand, interlace your fingers and rub. Repeat with the other hand. Step 5. Put your palms together and interlace your fingers and rub. Step 6. Rub the back of your fingers together with your hands in fists. Step 7. Make a fist around your thumb and rub rotationally. Repeat on the other hand. Step 8. Clasp your fingers together and rub them in a circle in the palm of your other hand. Make sure to do this on both hands. Step 9. Rinse your hands with water. Your hands are now clean and safe. Step 11. If you are at home, dry your hands with a clean towel. If you are in public, remember to open the tap with a single-use towel. Throw it away, dry your hands with a new single-use towel, close the tap with it, and throw that away too. Stay safe, friends, and thanks for watching. Grab your free step-by-step kid-friendly hand-washing printable available to download in the description of this video.
Thanks for watching!
Hand disinfection. Break down hand disinfection into simple steps. Focus teaching one step at a time and provide visual aids if necessary. Use a visual schedule to help children understand the steps involved in hand disinfection. Be prepared before practice. Make sure you have all the materials you need, such as hand soap, a step stool if necessary, and a hand towel. Use prompts to help children remember the steps involved in hand disinfection. Change the target step based on your child's success. If your child is struggling with a particular step, focus on that step until they have mastered it. Reinforce practice by providing rewards or positive feedback. Use hands-on activities to help children understand the importance of hand disinfection. For example, you can pour soapy, colored water onto disposable gloves to help children see where their hands are dirty. You can also cover your child's hands in glitter and have them walk around a specified space to show how easily germs are spread. Use workbooks, therapy materials, social stories, video modeling, and games to teach hygiene skills. This video presents essential practices to combat the spread of COVID-19 through the Do the 5 approach. It demonstrates the following key actions: cleaning hands with an alcohol-based hand sanitizer for a minimum of 20 seconds, using the bent elbow to cover mouth when coughing or sneezing, refraining from touching the face, avoiding crowded places, and maintaining a safe distance from others and staying home, especially when experiencing any COVID-19 symptoms.
The coronavirus is spreading rapidly across the world, and currently there is no cure or vaccine against it. It spreads through tiny droplets when infected people speak, cough, or sneeze. These droplets can land on surfaces to be picked up by hands and are impossible to see with the naked eye. But just because you can't see them doesn't mean that they are not there. And you may get infected if you touch your face, nose, mouth, or eyes. To help stop the spread of the virus, we all need to do the 5. 1. Follow these steps to clean your hands with an alcohol-based hand sanitizer for at least 20 seconds. 2. Cover your mouth with your bent elbow whenever you cough or sneeze. 3. Avoid touching your face. 4. Avoid crowded places. Keep a safe distance from other people. 5. Stay home if you can, especially if you have any of the symptoms. For more information, visit www.who.int.
Cough hygiene. It is also important to teach children to cover their noses and mouth with a clean towel when sneezing or coughing. Parents should keep their children away from strangers or foreign travelers, as the virus is transmissible from person to person. Children should also be taught to keep a distance of at least 1 meter from others to prevent the spread of droplets released when coughing or sneezing. Many children with disabilities struggle with following instructions and learning from experiences. Caregivers can help by demonstrating appropriate behaviors and inviting children to imitate them. It's important for caregivers to be patient and repeat instructions multiple times using different techniques if needed to ensure the child understands and can follow them. In the video, students will learn the appropriate actions to take when coughing or sneezing. It emphasizes the significance of covering your mouth and nose when coughing or sneezing, avoiding spitting in public spaces, and using a tissue to blow your nose. Afterward, the video emphasizes the importance of washing your hands thoroughly with soap and water for at least 20 seconds. Wearing masks. One effective strategy for teaching children with developmental disabilities to wear masks properly is through social stories. These are short, illustrated stories that describe a situation and provide information on how to behave appropriately in that situation. Social stories can help children understand the importance of wearing masks and how to properly wear and remove them. They can also address potential anxiety or sensory issues associated with wearing a mask. Another strategy to consider is using visual aids such as pictures or videos to demonstrate the correct way to wear a mask. This can help children better understand and remember the steps involved. Additionally, providing positive reinforcement such as praise or rewards for wearing masks properly can help motivate and encourage children to continue wearing them. One of the biggest challenges educators encounter when teaching mask wearing to children with developmental disabilities is a lack of awareness or understanding of the concept of mask wearing. Many children with developmental disabilities have difficulties related to sensory issues, language processing, and social communication. Therefore, it is critical to understand and address the individual needs of each child when teaching them how to wear a mask. Parents or caregivers can play an important role in teaching mask wearing at home, which can then be further reinforced in the classroom. In addition, we need to consider the specific needs and preferences of each child and offer different types of masks as alternatives to traditional masks. For example, sensory responsive masks or see-through masks may be more appropriate for some children. By considering these challenges and barriers, we can make the process of teaching mask wearing to children with developmental disabilities more effective and accessible. After watching this informative video, students will learn the importance of wearing a mask that fits their face properly. The video emphasizes that a well-fitted mask is crucial for effective protection against the spread of viruses, such as COVID-19. Students will understand that any gaps in the mask can allow the virus to escape, rendering an even high-quality filtering mask ineffective.
There is no one head size. Hats come in small, medium, and large. Eyeglasses are fitted. Just like with a hat or glasses, your mask should also fit your face, because any gap allows the virus to escape. No matter how good your mask is at filtering the virus, if it doesn't fit, it doesn't work. There are plenty of ways to get a good fit. Look for masks that come in different sizes and find the one that fits your face. Adjust the straps around your ears or head for a snug fit. Look for a mask with a flexible nose piece. Here's what to check. No gaps at the sides, no gaps at the nose, and no gaps around the chin. Now, breathe normally. Is it comfortable? If not, find another one. If it is comfortable, make sure when you blow hard, the air stays in your mask. Stay safe, close the gaps. And don't forget, it's not just about masks. Get vaccinated when it's your turn. Keep your distance, clean your hands, cover your cough with a bent elbow or tissue, and open a window.
This video provides important information about the use of masks to prevent the spread of COVID-19, especially in areas where the virus is widespread and maintaining physical distance is challenging. After watching the video, students will learn about the guidelines for children wearing masks to ensure their safety and protection.
In areas where COVID-19 is widespread and physical distance cannot be maintained, especially in indoor settings and areas with poor ventilation, masks can help stop the spread of COVID-19. Here's what you need to know about children and masks. Children under the age of 5 don't need to wear a mask because they may not be able to wear it properly without supervision or help. Children 6 to 11 years old should wear a mask in indoor settings where ventilation is poor or unknown, or physical distance cannot be maintained. Children ages 12 and over should follow the same mask-wearing guidance as adults. In indoor or outdoor settings, when they cannot guarantee at least 1 meter distance from others, and indoor settings where ventilation is poor. Children with disabilities should not be required to wear a mask. Children should not wear a mask when playing sports or doing physical activities. Children should wear a well-fitted mask that covers their nose, mouth, and chin. Children who are at higher risk of severe complications from COVID-19 should wear a medical mask for protection. Before putting on the mask, children should clean their hands at least 20 seconds if using an alcohol-based hand rub, or at least 40 seconds if using soap and water. Make sure the mask is the right size to cover the nose, mouth, and chin. Children should not touch the front of the mask, pull it under the chin or into the mouth, and definitely not share it. After taking off their mask, they should store it in a bag or container and clean their hands. With these simple tips and good supervision, children can stay safe while wearing their masks and still have fun with their friends.
The next video offers a comprehensive demonstration of the correct procedure for both putting on and removing masks. It provides step-by-step instructions and visual guidance to ensure that viewers understand the proper technique to follow. Social distancing. Visual aids such as diagrams and pictures can be an effective way to help children with ID understand the appropriate distance between people. Role-playing in a safe and controlled environment and positive reinforcement can also help children learn and practice appropriate behaviors. To ensure understanding, it is important to use simple and understandable language when explaining social distancing. A safe environment practice in can help children with ID become familiar with the concept. Social stories can also be an effective tool as they provide short narratives that describe social situations and the expected behaviors and consequences. Repetition and reinforcement are critical for children with ID, so consistent repetition of the importance of social distancing is necessary until it becomes a habit. The upcoming video focuses on social distancing and its key role in reducing transmission of infectious diseases. It shows what social distance means and highlights the need to maintain a safe physical distance from others in order to effectively limit the spread of the disease. Vaccination. Vaccinating children against COVID-19 is essential to protecting their health and establishing higher population immunity. Preparing a child with ID for vaccination may require additional support and accommodations. It may be helpful to use visual aids and social stories to explain the vaccination process to the child. Additionally, it may be beneficial to involve parents, caregivers, and healthcare providers in the vaccination decision-making process. The child might benefit from practicing relaxation techniques before and during the vaccination, such as deep breathing or listening to calming music. It may also be helpful to schedule the vaccination at a time when the child is well rested and comfortable. Healthcare providers may need to use alternative methods for administering the vaccine, such as a nasal spray or numbing cream, to reduce discomfort for the child. This is a video demonstrating the process of vaccination. Next video is about COVID-19 vaccine specifically designed for people with disabilities. The video uses a social story format to emphasize the importance of vaccination against infectious diseases. After the video, students will participate in an activity and group discussion about why vaccinations are so important to prevent the spread of infectious diseases and protect vulnerable populations.
Stay safe from COVID-19. Get a COVID-19 shot. Doctors say the shot will help keep you from getting very sick from COVID-19. When you get your shot, you'll wear a mask. You'll need to wait until it's your turn. Remember to keep a safe distance from other people. A doctor will give you a COVID-19 shot. The shot will help keep you from getting very sick from COVID-19. After you get your shot, you may feel tired. Your arm may be sore. You will feel better in a few days. Sometimes people need 2 shots. If you need 2 shots, you'll go back another day. The doctor will give you a shot again. It's the same as the first time. Your friends can get a COVID-19 shot too. A few weeks after everyone gets their shots, it's safe to see your friends again. Get a COVID-19 shot.
Quarantine and isolation. Here are some ways parents or caregivers can support the mental health of children with intellectual disabilities during quarantine. Provide clear and simple information about COVID-19 and the need for quarantine and isolation measures using visual aids if necessary. Maintain regular communication with the child's healthcare providers and seek their advice on how to support the child's mental health during quarantine. Encourage the child to engage in activities that they enjoy and that are appropriate for their level of ability, such as reading, drawing, or playing games. Create a daily routine that includes structured activities such as schoolwork, exercise, and leisure time to help the child feel more secure and in control. Provide opportunities for social interaction with family members and friends through video calls or other virtual platforms. Be aware of signs of distress, such as changes in behavior or mood, and seek professional help if necessary. This video, tailored for people with disabilities, demonstrates the proper way to stay home when sick with COVID-19.
Anthony, a young black man with Dandy Walker syndrome, looks out his window and waves.
Stay home when you are sick.
Anthony is resting in his bed. His cheeks are red.
You have COVID-19. You feel sick.
Anthony talks to his doctor on video chat.
Your doctor says you need to stay home for 5 days.
Anthony's dad brings him breakfast in bed. Anthony and his dad are both wearing masks.
You stay in your room so other people don't get sick.
Anthony walks to the bathroom. He uses a walking stick. He is still wearing a mask.
You wear a mask when you go to the bathroom. You always wear a mask when you leave your room.
Anthony says hi to his friends at the park. He is still wearing a mask.
When you are better, you can see your friends again.
Anthony points to his mask.
You wear a mask for a few more days.
Logo, CDC. Learn more at www.cdc.gov.
The following video shows how to effectively lower your child's fever. It describes 5 steps to manage fever in children. Thank you for your attention.